Welcome back to 12 to Your Health. I'm Roxanne Evans. Well, anti-aging treatments are big business these days, but just because one looks good does not mean they feel good. There's been lots of talk recently about bioidentical hormone therapy, which claims to help people keep feeling young. Here to tell us all about it is Dr. Michael Gross, Medical Director and co-founder of Active Center for Health and Wellness in Hackensack. So, Doctor, thank you so much. Exactly what is bioidentical hormone therapy?
Bioidentical hormone therapy is the use of various hormones in men and women to replace declining hormones in your body as you age. The goal is to almost fool your body into thinking, instead of you're 40 or 45 or 50, that you're actually still 30 or 35 years old. And as you said, that will make you feel better, but it also has health implications.
Such as?
Disease prevention. Many diseases are diseases of aging: high blood pressure, heart disease, high cholesterol. So if we can sort of reset the clock in your body and make your body not only feel like it's 30 years old again, but make it think it's actually 35 years old, we can prevent some of those diseases.
The signs of hormone deficiency are exactly what? What should people be looking for? Men and women, correct?
Correct. In women, you see all the signs that we're familiar with postmenopausal syndrome or perimenopausal syndrome. We see hair loss, hot flashes, night sweats, decreasing memory, weight gain, and decreasing energy, lethargy, just a sort of lack of joy of life.
Now let's go to the men. You can see them up there on your screen, Doctor. They are. And let me also ask you this. Does it have to be all 6 of these symptoms, or is it just maybe 1 or 2? When
one or two,
deficient?
exactly.
Really?
The 6 are the big ones that people think about are weight gain. Men start to get more weight around their waist. They develop that spare tire. They see less of a result when they're exercising. They have decreased libido, decreased sex drive, decreased energy, almost depressed all the time. And so when we actually give quizzes to people that if you have any of these symptoms, if you have decreased libido, that could certainly be a sign of a low testosterone.
Okay, and we were talking briefly before we started the show a little bit about the synthetic hormones that we've heard so much about, especially the negatives about. But compare and contrast synthetic to the bioidentical hormones.
The bioidenticals are just that, bioidentical. The synthetics had some of the same actions as your own hormones, but they were synthetic and they weren't completely broken down in your body. So then you had all these byproducts floating around in your system that could have harmful effects. With the bioidenticals, they are molecule by molecule the same as your own hormones. So we're not substituting, we're replacing. And those hormones are broken down 100% and have no ill effects from the byproducts.
Well, doctor, how do you get them into the body for both men and women? Is it an oral supplement or is it an injection?
Each one of the hormones are differently applied. Some of them are applied as creams, some of them are applied as pills. 1 or 2 are injected with small insulin type needles once a day. It varies from patient to patient. There are different ways that they can be introduced into the system, so we customize those applications for each person.
So the folks listening out there, Dr. Gross, are saying, sounds great, but give me the benefits. Tell me why I should be doing this.
Well, certainly we can reverse the effects of aging. So it's right there, that's a benefit.
Yeah, right there.
You'll feel better, you'll have more energy. We believe, and it has been shown, that you can reverse the effects of certain diseases. Your cholesterol can go down, will go down. Weight loss in men, their weight starts to redistribute, so they lose that spare tire. They'll get better. If they're working out in a gym, they'll have better results in the gym.
Okay, so of course when we're looking at some of the benefits up there on the screen right now, like you said, the reduction of fat, especially for men. All right, so you're saying you're giving us something by doing bioidentical hormone therapy, but people are always going to ask, what do I get? What's the payoff? What do I have to do that I'm going to lose in the risks associated with a procedure or therapy like this?
You have to be diligent. It's one of those things. You have to take the medications, and then you have to incorporate it into your lifestyle. Nothing is a silver bullet. So it also involves diet. It means watching your diet a little bit to eat more healthy, getting enough sleep. Certainly studies have shown if you don't sleep 7 hours a night, you're more prone to gain weight. So, you have to, it's a start, but it's not the only answer.
How long has this been out on the market? Because of course with synthetic hormones, it's always associated with cancer.
The bioidenticals have been around for years. They're starting to get a lot more press now. Suzanne Summers was on Oprah, and that became, and she's a big advocate of bioidentical hormones.
She is, right.
So it's becoming more and more popular. The effects of low testosterone in men are becoming more and more recognized, particularly the low libido, the low sex drive. So some of the commercial drug companies are now coming out with their own testosterone products. Typically, the bioidenticals are what we call compounded prescriptions. They're customized for you. We'll take your blood levels, we'll establish what you need, and the pharmacy will make custom medications for you that have exactly the dosages you want.
Very quickly, Dr. Gross, is everyone and anyone a candidate?
Everyone is a candidate, but not everybody ends up needing to have the medication. You come in our office, we do a panel of blood tests and other tests, and then we look at the results. And if it looks like, you know, you're doing fine, you don't need to do this, then we tell you this isn't for you. You know, keep up with your diet, keep up with your exercise. But certainly, if you have the symptoms, it's important to recognize the symptoms and then come in and be tested. Too many people have been bounced around from doctor to doctor and don't know why they feel this way. And that's the key to it.
Dr. Michael Gross, thank you very much
Pleasure.
for coming in. Stay with us, please, because there's lots more 12 to Your Health still to come. But first, here's a look at this week's Community Health Calendar. Thanks, Doctor. Very interesting.
Thank you.